Scanning the room.
Hello, my name is Sarah New and I am a first-year nursing student in the Dakota Nursing Program. And today I'm going to be demonstrating how to mix insulin, administer insulin subcutaneously, and how to use an insulin pen. Okay, so I just walked into the bedroom, I performed hand hygiene. Before I go into the medicine cabinet, I need to go ahead and compare my doctor's orders with my MAR. Alright, so first things first, you compare the patient's name, and it's Shirley Coast, and that matches our MAR, Shirley Coast. Date of birth, 5/14/64, and that matches. Room 211, that matches. So we have the right patient for the orders in the MAR. First thing scheduled is the NPH insulin U100 15 unit subcut daily with supper, and that matches our NPH insulin U100 15 unit subcut daily with supper. Excuse me, she is scheduled to have this at 17:30. It is 17:15 now, so that makes sense to me. Our second insulin is going to be the regular insulin, and that is a U100, and she needs 10 units of that twice a day. That matches our MAR for our regular insulin, U100, 10 units subcut, twice daily, and she had her first dose this morning in her right upper arm at 7:30. So I know that it is time for her to have her second dose, which is scheduled for 17:30. It's 17:15 now. So those match. Okay, and then her last medication ordered is the Lispro insulin pen, and that is a U100. The doctor is using a mild sliding scale. There's going to be a subcut injection 3 times daily with meals. And let's see, that matches our MAR. So we have our insulin Lispro U100 insulin pen, also using a mild sliding scale, subcut 3 times daily with meals. She had her breakfast, she had her lunch dose, so now it is time for her supper dose. So that is scheduled for 17:30, and it's 17:15 now. Okay, so everything matches here. I know that all of these insulins are compatible. They our regular and our NPH can be mixed. And let's see, she has an allergy to codeine. We have that documented, but this is all insulin, so it does not contain any codeine. Okay, so those match. So now I can go ahead and get into my medicine cabinet. So again, perform hand hygiene. So we'll do our first medicine check. I'm looking for NPH insulin U100. Okay, and we have our NPH U100, and this is my patient's medicine. It says her name, Shirley Coast, 5/14/64, room number 211. So I know that this is my patient's medicine, and I know that this is our intermediate insulin, so it's going to have an onset of about 2 to 4 hours. Next, we're going to get our regular insulin, U100, 10 units, subcut, twice daily. She had her breakfast dose at 07:30, so she needs her second dose with supper at 17:30. It's 17:15 now. All right, so we have our regular insulin. This is the clear insulin, 100 units per mil, so I know that that's the U100. And this is Shirley Coast, 5/14/64, room 211. And the regular is the short acting, but it's going to have an onset of about half an hour to 1 hour. So those are good to go. And then we also need a insulin Lispro pen, and that again is using the mild sliding scale, subcut 3 times daily with meals. She had her morning, her lunch, so it is time for her 17:30 dose. It's 17:15 now. My CNA did report that her blood glucose was at 178, so we'll document that. And looking at her sliding scale, I see that I need to give her 2 units of insulin. Okay, and this is a rapid acting, so it's very important that we make sure that there is food in the room, which it is, it just arrived. So we'll talk to her about the importance of making sure that she eats all of her food. Okay, so we need to make sure this is my patient's pen, and this is Shirley Coast, 51464, room 211. So this is my patient's pen. Okay, and that's gonna start working in about 5 to 15 minutes. So I know that this is the right time to be getting that ready. Okay, so now it is time to prepare our medication. I will gather all needed supplies. I will perform hand hygiene, don my gloves. And while preparing them, I will be doing my second medication safety check. Okay, so first we're looking for the NPH, and that is the cloudy. So again, just checking to make sure everything, nothing is expired, nothing looks grainy, the color and consistency is good. For the NPH, we just need to mix gently by rolling it. Okay, and then we'll just make sure it matches. So we have Shirley Coast, 51464, room 211. That matches my MAR, and this is the NPH U100, and she has been ordered 15 units subcut daily with supper. It is supper time, so I know that this is the time to be giving her that. And before I mix it, I'm gonna go ahead and verify we have our regular insulin, and it's the U100. And this is Shirley Coast, 51464, room 211. That matches our MAR. Okay, so she needs to have the 10 units subcut twice daily. She had her morning dose. It is time for her evening dose, so that matches with our time. Okay, so before I draw that up, I need to clean the tops. Some alcohol. And you want to scrub that for 10 to 15 seconds. And 15 seconds. Okay, so we're going to be using a 1 milliliter insulin syringe, just making sure that it is the right gauge and needle length, and it is. Okay, so we have 15 units of the cloudy, which is the NPH, 10 units of the clear, and that is the regular insulin. So we're going to go ahead and draw up a total of 25 units of air. Okay, filling straight off. I want to add my air to my NPH first, so just verifying that that's the NPH. We need to add 15 units of air to this. So we'll go ahead and take that down to the 10. Okay. All right, so now we have our regular. We're gonna add that 10 units of air. See that number? Okay, so keeping the needle in there, I'm going to invert the vial. Okay, and we just want to go ahead and pull down gently. Getting our 10 units, verifying with the second nurse that this is my patient's medicine, and that is, according to our MAR, what she needs to have. Okay. All right, so again, just making sure that our NPH is nice and mixed. That way we know that the medicine is evenly dispersed throughout the vial. Okay, that looks good. All right, so now I'm going to do the same thing, just go straight down in the middle. And we're going to draw up a total of 25. So that was 15 of the NPH. And verifying with the second nurse that everything looks good. Making sure we don't have any air bubbles in there. Okay. So I need to walk down the hallway with this. So this is the one time that you are allowed to recap a needle. So just stick it in there gently and push down. Okay, so we need to go ahead and add our label to that. This is regular insulin, 10 units, and pH insulin, 15 units. I have my initials and the date and the time. Okay, so that's ready to go to the patient's room. Okay, so we can go ahead and put these back in our cabinet, just make sure that's secure. All right, so now I'm going to be getting our insulin pen ready. And again, I just want to do a second safety check. This is Shirley Coast. That matches my MAR 51464. That is her. Room 211. And this is a U100 of Lispro. So that is what our MAR has ordered. So we'll go ahead and take the cap off. We want to check and make sure that the medicine is clear. It's not cloudy. It's not grainy. So that is good. And again, I've already documented that my CNA reported a blood glucose level of 178. So according to our mild sliding scale, I need to give her 2 units of insulin. Okay, so before I do that, I am going to clean the tops. Clean the top. Okay, so you want to scrub for about 15 seconds. Okay, so we have obtained our insulin pen needle. I just want to check that this is not expired, it has not been opened, and it is the correct gauge and length, 30 gauge, 3/16 inch. So that is good to go. We'll go ahead and peel off the top. And just screw it in. You want it to be snug, but not too tight. Okay, so we need to prime this before we put our medicine in it. So I'm going to click it over to 2 units. And just hold until we see the insulin come out. And then the vial goes back to 0. Okay, so again, she has been ordered the 2 units of insulin. So we'll just go ahead and click that over. It's been primed. That's good to go to the patient's room. So we'll go ahead and recap that. Add our label. I'm going to just put it right here. Well, no, because we want to check when we get to the room. Okay, so our insulin is ready to go to our patient's room. Got our alcohol wipes. I'm going to go ahead and clean up my station before I exit the bedroom. Okay, so I will doff my gloves, perform hand hygiene, and make my way over to my patient's bedside. Okay, knock knock. Hello Shirley, my name is Sarah. I'm going to be your nurse today, and I'm here to give you some insulin injections. Can you give me your name and date of birth, please? Shirley Coast, 51464. Thank you. And do you have any allergies that you know of? The codeine, yep, I see that documented on your record. All you're going to be getting today is insulin. So how long have you had diabetes? 10 years? Okay, so you're definitely used to this. Do you normally take the mixed NPH, the clear and the cloudy? You do, and do you like that in your stomach, in your arm, in your back? You prefer it in your stomach? Awesome. Do you normally take the insulin pen with dinner? Okay. Yep, we have that for you too. All right, so before we get that injected, I'm going to go ahead and just check your stomach. So there's no skin breakdown. Everything looks good there. We can go ahead and give it to you in your lower abdomen because I can see that they gave it to you in your left and right upper abdomen today. So we'll go ahead and do the left and right lower. So let me just go ahead and perform hand hygiene and don fresh gloves. Okay, so we're doing our 3rd medication safety check at the bedside. I'm going to go ahead and verify all meds and then I will inject them. So first things first, we have our regular of 10 units, and then we have our NPH insulin for 15, and that does match our MAR. She needs her 15 units of NPH with dinner every day, and it is getting close to 17:30. Okay, and your supper's here. You like that food, right? You're going to eat it, okay, because it's very important that you do. Okay, and then we have her regular insulin for 15 units, and that matches my label. Okay, and that is to be given twice daily She had her morning, so now it's time for her 17:30 dose. And then we need to give you the fast-acting Lispro pen, and we already know that she needs 2 units. Let me just make sure it's still at 2, and it is, because her blood glucose was 178, using a mild sliding scale. All right, all that sound regular to you? Yeah? Okay, so we're just gonna go ahead and clean your tummy. We're gonna do the left side first. And allowing that to dry. So we're gonna go ahead and pinch. Now, if you were able to pinch 2 inches of tissue, of skin, then you could go in at a 90-degree angle, but with this little guy, we can only get about 1 inch, so I am gonna go in at the 40. All right, so you ready? Okay, here we go. And we're just gonna inject that somewhat slowly. And pulling straight out, making sure there's no insulin there. Looks good. Okay, so we're gonna go ahead and activate our safety device and throw that in the sharps container. Okay, all right, we got 1 more for you. You're gonna get 2 units, just verifying again that it is the 2 units. Okay, so we're gonna go ahead and move this over here. Let me just clean that one more time real quick. And moving from the center where the injection site is and out. Okay. So allowing that alcohol to dry. Again, we're gonna go ahead and pinch up. Now with this one, this needle's pretty small, so we can just go ahead and go in at the 90. So you wanna hold it like a pen so that your thumb can reach the injection site. Pushing down so you hear that click so that you know that it is flush. And holding down till you hear the 2 clicks. And holding it there for about 10 seconds. And release. And we just want to check and make sure everything looks good there. There's no blood. She doesn't need a Band-Aid. It's normal to have a little bit of insulin, but most of it went in. Okay, so we will just gently unscrew this. It's red, so we know that our safety is engaged. Going in the sharps. Okay. Yeah, that wasn't so bad, was it? You're pretty used to this after 10 years. It's a long time to be dealing with diabetes, huh? Okay, so let's just get you situated here. I'm gonna get you sat up so that you can go ahead and eat all this food. You have your call light here, so let me know right away if you start feeling dizzy or sweaty or just feeling funny, so call us right away if that happens, but we will be back in 10 minutes to check on you regardless. Okay, you have a wonderful meal and I'll be back to check on you.